Greetings and welcome. I love iodine here with another video on intestinal parasites. This video is going to cover the Taenia species. I'm currently taking a course in tropical parasitology, and this week we are covering the Taenia species. I wanted to bring some information out. I'm very familiar with this. I was personally infected with a fish tapeworm, intestinal flukes, and likely, possibly one of these as well. I did see some things that would suggest this, but I definitely know the first two. I'd like not to think about this one because this one frightens me for some reason. But I'm not here to frighten anybody. I'm here to give hope if anybody's having issues and they don't know what they are. Please check out my symptoms video. One thing we do know about parasites is the person that's infected may not have symptoms for many, many years, but that does not mean that the parasites aren't doing damage to your body. They are robbing your nutrients, and eventually you will become weaker and weaker, and health issues may arise as a result of a lack of nutrients. Also, the parasites are excreting their toxins into your body. This is going to toxify your blood, it's going to make your liver work harder, your kidney to work harder, and it's going to cause a dysbiosis in your intestinal tract. We definitely don't want that. We know that the majority of our immune system is in our intestinal tract, our gut microbiome, and we need to keep that healthy because we need to protect ourselves. So it has a parasitic infection can cause a lot of consequences, especially if left unaddressed. And it makes it very difficult to address a parasitic infection if you're unaware that you have one. It makes it really hard to address one if you're unaware that it's even a possibility that you could have one. I will say that most doctors aren't going to test you for it, which in many ways is illogical considering when we take our dog and our cat to the vet, that's the first thing a vet does is check their stool and checks for parasites. It is known that we can get parasites from our dogs and our cats, but yet we do nothing about that. Toxoplasma gondii is a protozoan parasite that we can acquire from cats. Please check out my other videos. I go into greater detail on that, and this one's going to stick more closely to the tapeworms. But just keep those things in mind. And also, we can get tapeworms from our dogs and cats. I know it's lovely, isn't it? But it's true. So anyway, that being said, I'm going to read a little bit of the information on the CDC website. Taeniasis in humans is a parasitic infection caused by the tapeworm species Taenia saginata, which is called the beef tapeworm, Taenia solium, the pork tapeworm, and Taenia asiatica, which is the Asian tapeworm. Humans can become infected with these tapeworms by eating raw or undercooked beef or pork. People with Taeniasis may not know they have a tapeworm infection because symptoms are usually mild or non-existent. Reverse. Let's say this one more time. People might not know they have an infection because symptoms are mild or non-existent. That does not mean that they are not causing damage to your health. By the time you have symptoms, then you're already at a point where you have problems. In my case, by the time I found out that I had it, I had already had problems for quite a while, and no doctor ever mentioned parasites as a potential cause. I went to many doctors, I was tested for many things, and I was diagnosed with many diseases. I was also prescribed many pharmaceuticals. I'm a little on the stubborn side, and I refused to take them until I could get an answer as to what was causing my problems, and boy am I glad that I did. Had I taken them, I would have just masked maybe the symptoms for a while I would have let these things grow inside my body, and I don't know if I would have liked how that would have turned out. Anyway, I found out I had a tapeworm, and I was able to get rid of it, and all of my health issues have reversed, and I'm still trying to build up my nutrient stores, but it's all going pretty good. No complaints, getting there, getting better, and I'm just trying to share the information that I learned, and hopefully this will help many of you out there. If you want to check into the symptoms, please check out my video on the symptoms. Also, I have a video that highlights the foods that are naturally anti-parasitic. I have a video on the herbs that are naturally anti-parasitic. What I was doing when I was creating my own protocols is putting those together, making meals, focusing on the anti-parasitic foods, doing some juicing, and incorporating it with the herbs, putting together things that worked for me. If you're unfamiliar with herbs, definitely you can take some of that information that I present and take that list, talk to an herbalist, talk to a naturopathic doctor. If you have the symptoms, please take that information and speak to your healthcare provider and try to get tested, see if you can get a test. The one thing about getting tested, it is a little invasive. I mean, you do have to take days worth of your stool, and also they could go into other tests as well. But that is up to you. I just want to provide the information, and how you choose to deal with this is on you. But I do highly recommend making sure that you take care of it, because the one thing is, it doesn't just affect you. If you're infected with the pork tapeworm, as we're going to talk about a little bit more in a moment, you can infect others. Other tapeworms aren't transmitted that way. They actually have to be transmitted by eating undercooked meat or through some other contamination, and it's not easily transmitted through the feces of humans to another human. But the pork tapeworm is one that can't easily be transmitted that way. Okay, so we're going to talk a little bit more about the Taenia solium, and that's the pork tapeworm. And it can lead to a condition called cysticercosis. And when it's in your brain, they refer to it as neurocysticercosis. And it's a disease that can cause seizures when it's in your brain. This is where the larval cysts go out through your body, and they encapsulate. They could be in your brain, your muscle tissues, your liver, your heart, wherever. And they can cause seizures if you're in your brain, especially if you have a high parasitic load. It's going to be putting pressure on various parts of your brain. Of course, what it's going to cause is going to depend on where they actually are located. But it can also cause early onset dementia. It has been associated with, of course, headaches. And in severe cases, it can be deadly. So please do keep this in mind. This is something I think, honestly, people should address by doing a parasite cleanse at least once a year to keep that load down. I mean, the fact is, if you have cats or dogs, if you've ever, I don't know, if you're alive, you have a good chance of coming into parasites every single day of your life. You don't have to travel outside the country. We have plenty of tapeworms and other parasites in the United States. Now, granted, I know that there is more, there's different types in other countries, and I know in the tropical regions of the world, they do have issues with protozoan parasites causing malaria, and that's, of course, transmitted by a mosquito, and we don't have that here. I understand that. I understand that we don't have tsetse flies in America that are causing the Gambian sleeping sickness, or the Tanzanian, the other one that there's the East African and the West African. So we don't have those here, and I'm aware of that. But we do have plenty, and we're not addressing it. And if you wait till you have symptoms, you are waiting, I think, a little too long. So let's look at the map here from the WHO. And it shows countries and areas at risk of cysticercosis. Quite a lot there. If we look at the dark blue, we have the majority of South America, almost all of Central America. We have, of course, Mexico. We have various parts of Africa. The gray areas, don't think that's the safe areas. That's actually just where there's no data available. Those could all be blue too, for all we know. And so basically, everything is blue. We have the dark blue. We have some light blue. The light blue is actually where it's imported cases. Possible human cysticercosis transmission. And again, we're talking the fecal to oral route. Again, just a simple example, somebody who's infected, we'll call him Tom, goes to the restroom and gets a little fecal matter on his hand when he is wiping, doesn't do a very good job of washing it off. And say Tom works at your local diner where you like to get your food. And he's responsible for making salads today. Say he doesn't wear gloves when he's doing it, because he felt that he washed his hands enough, and that's just the way that it is. And he transmits the fecal matter, a little bit goes into the salad. You eat that salad, now you are eating contaminated lettuce, don't even know it, and now you can become infected with the pork tapeworm. It seems that this is more likely a case than actually eating undercooked pork. Most people cook their pork thoroughly. I mean, that's just, we know to do that because we know that they can transmit a couple of different types of tapeworm. We know there's a roundworm infection that's very, very common in pork. So people have definitely learned, and I would assume it tastes better when it's cooked. I'm not a person that eats pork, but I know many people that do. I'm going to flip over to this article here. It's called Neurocysticercosis, a review. And it goes on to talk about that neurocysticercosis is the most common helmintic infection of the nervous system. Helmintic just means worm, and is a leading cause of acquired epilepsy worldwide. The disease occurs when humans become intermediate hosts of Taenia solium by ingesting its eggs from contaminated food, or most often directly from a Taenia carrier by the fecal to oral route. Interesting. So just think about that. Most often is from the fecal to oral route, not from eating uncooked beef. And as you see, whenever we have cysticercosis, this is actually where we're the intermediate host. We can also be the definitive or the primary host. So this is a very interesting species for humans because we act as both. And if you don't understand that, maybe I can explain that in more detail in another video. As things go on, I think you'll get the understanding of what I mean by the final or definitive or primary host, or the secondary host or intermediate host. Okay. All right, so we're back to the map. So as you see, we have the United States here next to Mexico. It's clear that there's a wall here between Mexico and America that prevents America from being dark blue. And if you don't know that I'm being sarcastic, I'm absolutely being sarcastic. I would have to say that we're probably a little bluer than what this says here. We like to pretend that we're super clean in America and that these things are of a low risk. But I don't think that's true. But that's just my opinion. You can feel free to disagree with me. So in my course this week, we're covering the Taenia species, like I said. And the other thing I want to address in this video is I do a lot of research on parasites, and I have been since I found out that I was infected. It was a little difficult to be learning a lot of the foods that were anti-parasitic after I already had a parasite. And I was thinking, wow, I wish I would have known that when I had begun my treatment. It would have made things a lot easier because it would have been more food I could have eaten. And it would have also maybe made the job of actually eliminating my parasite a little easier. That's why I tried to put together as many of the foods and herbs that I learned in one concise way, that you have just one sheet that lists all of them. So if you wanted to make a grocery list out of that, it would make it a little bit easier rather than second guessing or wondering. And I also hear a lot of people online, they'll tell you what'll kill parasites, and I always wonder, have you even had a parasite? Have you ever done a parasite cleanse? Do you even really know this from firsthand experience, or are you just regurgitating things you picked up from who knows where? And a case of this, or example of this rather, is in this course that I'm taking, which I'm greatly enjoying. I'm learning, some things, not saying anything negative. But in the same week, we get different lecture slides. The first set is talking about the Taenia solium, which is the pork tapeworm. And it says here that the adult worm is attained in 3 months and it is 4 to 7 meters long. It contains 1,000 proglatids. All right, fair enough. But if we go over here, it says that the matures into adult cestodes 2 to 8 meters in length over the next 3 months. So in one case it's 4 to 7, and in another case it's 2 to 8, and we're talking the same exact class. So keep that in mind. You're going to hear a lot of variability when people talk about the size of the tapeworms. I have read online that the pork tapeworm can only get to be 9 feet long, 3 meters. I've heard that the beef tapeworm is bigger than that. The truth of the matter is, I think there's a lot of unknowns with respect to parasites. You'll see on websites where they'll say that tapeworms can get to be 100 feet. Well, that's true, but don't think that can live in you. There are tapeworms that infect other mammals. Remember that the great blue whale is a mammal. The tapeworm that infects the great blue whale is going to be much larger than what can inhabit in your body. We're not elephants, we're not whales. We cannot get a tapeworm that's 100 feet long, okay? So if that's your fear, only be concerned that you can get a tapeworm about 30 feet long, which is gross enough, but it is what it is. I had the fish tapeworm, and that's actually the Diphyllobothrium latum, and they can get to be 30 feet long, and I got rid of it, and mine was really, really big, so don't get freaked out. And it's really strange because, I had this for 13 years, and I never felt anything. It was only until about year 11 or 12 that I was thinking, I think there's something wrong with my stomach. There was one point after year 5 that I thought there was something wrong. I had a little surgery in my stomach for a hernia, and about a month later I thought that there was something wrong. And I went to the ER. I said, I think there's something wrong, that something like broke or it's not right. So they did a CT scan, and they said, no, you're fine. The surgery's fine. Everything is And I said, I don't know, I don't feel right. Well, I didn't feel right because during the surgery, it probably shifted the tapeworm. So it must have got bunched up a little bit, and it caused like extreme discomfort, pain. And, I did try to seek help, and they just told me, no, there's nothing wrong with you. It's all basically in your head. And the reason that they couldn't see anything is, if you think about it, a tapeworm is like a ribbon, and it's long, and it's actually going through the outline of your small intestine. It's not going to show up on a CT scan, especially, the CT scan that I was getting, they were probably just doing this section near my navel. They weren't doing the whole abdomen. But even still, it would just basically look like, oh, that must just be fecal matter, just, passing on through the tube. It wouldn't look like anything because it's not going to stand out as a big, softball, or it's not going to be balled up in that fashion. As time went on, especially like year 12 and a half, I was really highly suspecting that it could be parasites because, especially if I ate gluten, it was as if there was a brick in my stomach. But then I was diagnosed with gluten intolerance and likely celiac, so I thought that was the answer to all of my problems. Unfortunately, that wasn't the answer to all of my problems. It's just that if you have a tapeworm infection, you are going to react in a very negative way to gluten. And you can check out my other video that, if it's not up yet, it'll be up soon, where I discuss the parallels between the symptoms of celiac disease, gluten intolerance, to the symptoms of parasitic infections. I will give you a little hint. They're the same. So if you have gluten intolerance or you have celiac disease and you've never addressed parasitic infections, you might want to. If you don't think that a parasite, a tapeworm laying in your intestinal tract, is going to shave and wear down your intestinal villi, then you are going to have to think, give you a little analogy. If you have some carpet and you lay something down on it, it's going to smash it down. So a tapeworm is just laying in your intestines. It's going to wear down your villi, and it's going to do damage. Plus, you have the hooks and the suckers. That's going to cause damage as well. So just keep that in mind. I'm not saying that that's the case and cause for every single instance, but I can guarantee you it was the case and cause for me. So maybe it's the case and cause for you as well. Okay, we're going to finish up with a brief discussion on the beef tapeworm. And the only reason I'm covering this is because I found that this slide, which is part of my lecture for the week, was very interesting and very funny and somewhat confusing. Humans are the definitive hosts of Taenia saginata. Okay, got that. Usually, infected humans show few symptoms. Intestinal obstruction may occur. Okay. Also, abdominal discomfort. Okay, I'm good with all that. Till I get to the last line. Presence of proglatids crawling out of anus is embarrassing and unsightly. What? How does this happen? I know this happens with pinworms, and they crawl out and they leave their eggs around the outside around the anus. But how in the world do these proglatids crawl out? Because as far as I know, and from what I've learned, they don't crawl. They break off the segments and go out with your feces. They don't have that type of muscular structure that they're crawling. They just break off and go along for the ride in your feces. So I think this is a little misinformation. If anybody's out there that has any evidence of this actually occurring with tapeworms, that the segments, the proglatids, crawl, please let me know. And if they're crawling out of your anus like en masse, as the video portion of this lecture indicates, where the lecturer says that it's highly embarrassing when other people see the proglatids crawling out of your anus. And I'm like, wait a second, this sounds like pinworms to me, and it could be very easily getting them confused. And pinworms do crawl out in mass, and you might see like a cluster of them, and yes, that would be unsightly, and I can agree with that. But I think that this might not be true, and maybe I'm wrong, but if I am, I would like to know that. So if anyone has any information on that, please let me know and put it in the comments, and I would really appreciate it. I hope this information has been helpful. I'm going to close by going over to a picture of burdock and then talk for a little bit about this wonderful picture, and then we will close up. But that's about all I'm going to talk about. I want to thank everybody. Have a great day. I hope this information was beneficial. If you haven't subscribed, I would appreciate it if you did. If you liked the video, please hit the like button, and I will make more like this. If you'd like to leave a comment, please do. If you know anything about the tapeworm that can crawl out of your anus, please let me know. I would like to hear. I don't really want to hear about it, but I do want to hear about it. And we're going to close with this nice picture of burdock. This is a picture of burdock. It's a first year burdock, which is very beautiful. And this is where you would want to harvest the root, would be at the end of the first year. Or at the earliest would be the beginning of the second year before it gets its actual stalk that sprouts up where it flowers and then goes to seed. But the first year is where you want it. Burdock is a very delicious root. It's also very beneficial. You can tincture it, and it's very good for your kidney and your liver. You can also make tea out of it. It's a very delicious tea. And you can also eat the root. You can make it into a stir fry. It's very popular in Japan. I enjoy it very much, but here it grows pretty much all around the country, maybe in an area where you live. I know where I live on the East Coast, it is pretty much everywhere. You may be more familiar with it when it comes into its second year and it grows its stalk. And it has the burrs, which were the inspiration for Velcro, which is very interesting because they stick to you. And you may have had some stuck to your shoes or your socks if you've ever gone out for a hike in the fall. Or they might get stuck to your dog's fur if you ever take a dog out with you. So anyway, I just wanted to talk a little bit more about the burdock. And again, just thank everybody. If you haven't had a chance to check out my videos on the symptoms, I really encourage it. I go into detail on the vitamin B12 deficiency symptoms. I don't go into detail on the iron symptoms. Maybe I'll do that in a different video if there's interest. But just keep in mind, the fish tapeworm is notorious for robbing your B12 and depleting it. Intestinal flukes, they're definitely going to take out that iron. Iron is absorbed primarily in your duodenum. That's the portion of your small intestine right at the top. So if there's anything blocking that, any type of parasite, any type of flukes, you're going to have difficulty absorbing iron. For me, I was iron deficient, and I did what anyone else would do. I went and got an iron supplement, and I changed my diet to get more iron in my system. I never thought, oh my goodness, I'm iron deficient because I have flukes living in my duodenum. At that time, I didn't even know what that was, either of those things. So that being said, if you start getting any type of subtle warning signs, maybe an iron deficiency, maybe you're low in B12, maybe some fatigue that's unusual for you, or if you're a woman and your cycle starts getting a little amiss, these are warning signs. Consider a parasitic infection as being the cause. Most doctors aren't looking out for this. I have mentioned time and time again that when I started getting health issues, I did seek medical help. I went to doctors for years, many specialists, endocrinologists, gynecological endocrinologists, different family practitioners, allergists, and dermatologists. And all I got was, I was tested for many, many, many things. I mean, I've been scanned and x-rayed and had lots of ultrasounds looking for other things, and I've had so much blood work that I really don't ever want to do that again. And all I found was what I didn't have, or I found I was very low in a lot of things. I found out that all of my hormone levels were completely upside down. I found that my immune system wasn't functioning properly, but I never found an answer. And I was diagnosed with many things. I was prescribed many pharmaceuticals. I refused to take them. May have said this before, but I'm a little stubborn that way. So just keep these things in mind. We really need to take care of ourselves, okay? Peace and love. Make sure you're kind to each other. In fact, I try to be kinder to others than I would expect them to be to me, because we really need to spread some love in this world. It seems right now we could use a little more of that right now. All right, peace and love. I'm out.